Men cancer rates are expected to go through the roof in upcoming decades, and we have to be concerned about it. Dr. Donna Shaw-Lee joins us now. And joining us on the Factor Uncensored tonight, we have with us Dr. Donna Shaw-Lee, who has some bad news for the guys out there when it comes to our health, our future, and cancer. So we will see some astronomical numbers in the future, 25 to 30 years from now. And as time moves on, we'll see those numbers increase. But we're talking about a major increase in the number of cancer patients, cancer cases in men. Tell us about that, Dr. Ali.
Yeah, Isaiah, this recent study that came out by the American Cancer Society looked at over 145 different countries and looked at their historical occurrence rates of cancers and looked at men versus females, looked at other risk factors as well. And what they found is a significantly uptrending number of cases of cancer, specifically in men. And by the age of, or by the year of 2050, we're projecting a 90% increase in the number of cases of cancer in men specifically, and over 85. We know that the population is aging, people are living longer. However, we also know that there's risk factors that are also associated with that. And some of these risk factors are what are showing to be more prevalent and evident in the higher risk that the men are getting diagnosed with these cancers, Isaiah.
And what are some of those risk factors that people can look out for or adjust their lifestyle so they won't be a statistic?
Yeah, for sure, Isaiah. There are modifiable risk factors and non-modifiable, right? So non-modifiable are your genetics, your age, your ancestry, but there are modifiable risk factors. And the biggest risk factor that we've seen with this study is that, Isaiah, number one by far is the number of folks that were associated with cancer and smoking. So smoking single-handedly increases your chances of having cancer significantly, okay? There are other risk factors such as obesity, alcohol use, and also environmental factors. As we know, men are more in the factories, more exposed to toxins that can cause cancer. But by far, the tobacco is the number one risk factor that's modifiable, that has shown studies that have really correlated that very significantly.
And so when we think about smoking, we think about lung cancer, those types of cancers. What other kind of cancers did they pinpoint in this study where we will see a sharp increase? All forms in men or just specific cancers in men?
We do know that throat cancer, lung cancer, mouth cancer, all of those are definitely associated and do have a higher risk as well in folks that are smokers. But for example, prostate and other like colorectal cancers, those have also shown an association with the tobacco use and higher chances of having cancer with that. So any form of cancer, Isaiah, if you are a smoker, you're definitely at a higher risk. And that's where it comes into getting tested early, discussing with your primary care doctor and your physician about some of these risk factors that are modifiable and can help make sure that you may not be down that track of cancer. Specifically, early testing, Isaiah, for example, colorectal cancer screenings, prostate screenings. These need to be happening at an earlier age, especially if you have risk factors, family history, or you're a smoker, heavy tobacco use. Those are all risk factors that you should talk to your primary care doctor and get screened for at a much earlier age than what the normal recommendations are.
And just today, I saw on television a home kit for screening for colon cancer, but would you trust that?
Isaiah, it all depends on risk factors. I mean, this is a good starting point. Again, each patient is different. It is a good starting point. It is something that you can do in advance of visiting with your doctor, but nothing beats an actual office visit. Nothing beats other blood work that they can do to make sure that you are not in that category or that you're not in those risk factors that you may need to be screened earlier. So yes, you can get those. Those are screening tools. They're helpful. However, it does not replace your visit with the doctor that you should be doing on a regular basis to see if you have risk factors and other things that may lead you to cancer earlier on. We've got to get folks tested, Isaiah. We've got to look at those risk factors. We've got to get people to stop smoking and live a healthier life, Isaiah.
Absolutely. We appreciate you, Dr. Donnelly Shaw Lee, Arch Point Pain Institute. We appreciate your time tonight.